I really appreciate you all attending this virtual information session on Virginia's opioid settlements and the authority and the funding that will be provided to localities. I'd like to also express my appreciation to the Virginia Institute of Government, who has facilitated this meeting and is hosting the event, obviously. So again, really appreciate your help putting this all together. So this is one of two sessions being held, the other being scheduled for December 13th. So in terms of the format of the presentation, what I'd like to do is provide some background information on how the opioid settlements came to be, the settlement structure and allocation, a little bit of information about the OAA, and the timeline we're currently looking at with respect to creating the policies and procedures and infrastructure to provide guidance to localities on the grant application and submission process and distributing the funds pursuant to those requests. So given that, I'll just go right into it. So a little bit of background information. I don't know, I apologize if you are all familiar with how the opioid settlement funds came to be, but beginning with a little bit of background, going back to 2007, there were guilty pleas made by Purdue Pharma executives in federal court in Abingdon, Virginia, related to criminal charges that they'd misled regulators, doctors, and patients about the drug's addictive properties and the risk for abuse. That was followed by thousands of civil suits against Purdue and various other defendants in the pharmaceutical supply chain. That is the opioid manufacturers, distributors, and certain management consultancies. And those suits were mostly made originally in the Appalachian area of the U.S., including West Virginia, Kentucky, Tennessee, Virginia, and so forth. And those included state and local government entities. In late 2017, a federal judicial panel consolidated all of those disparate, the thousands of individual lawsuits into one single multi-district litigation, or MDL. Legal experts have described it as potentially the most complex civil case in U.S. history, and I have certainly found it very complex and tedious. So I definitely agree with that assessment. So while there are several settlements still being negotiated, the parties that have reached a settlement thus far, and this would be reflective of the funding that you all have received individually, your local direct shares, are the three largest pharmaceutical supply chain distributors. That's McKesson, Cardinal Health, and AmerisourceBergen, as well as opioid manufacturer Janssen, which is a subsidiary of Johnson & Johnson. So the plaintiffs in these cases are the state's attorneys general and the plaintiffs' lawyers from the MDL representing the political subdivision. So Virginia's settlements are based on these agreements negotiated at the national level and entered as a final consent judgment here in Richmond Circuit Court. So with respect to Virginia's participation in these settlements, it includes just the state and its legal subdivisions, which are the cities and counties, and it doesn't include any individual claims or private interests. So it's not going to include towns, for example, because they're going to be part of their county, right? So and it doesn't have any individual claims or private interests. So in late 2021 and earlier this year, the Virginia Attorney General's office worked with local attorneys and outside counsel representing localities to encourage all the cities and counties to drop their individual suits and join the MDL. And fortunately, all of the Commonwealth's 133 cities and counties ended up joining onto the MDL, which was good because that really kind of maximized the amount of funding that was made available to the Commonwealth, and not every state was able to accomplish that goal. So that was definitely good for the state. So all of the kind of legal documents, both judicial and statutory, related to the settlements and the authority are kind of woven together as the consent judgment incorporates the settlement agreements, the state's MOU, and Virginia Code. So this is a quick look at the code section that establishes the authority. So essentially, as I spoke about this, the three key elements that form Virginia's guidance for opioid settlement fund distribution. There's the settlement agreements, there's Virginia's MOU with the cities and counties, and then Code of Virginia Title 2.2, Chapter 22, Article 12, which creates the Opioid Abatement Authority and the Opioid Abatement Fund. Very important to note that if there is contradictory or conflicting terms and conditions on the settlement distributions among these documents, the settlement agreement and court orders effectuating that agreement will generally control. So this is a quick look at the OAA's board of directors. So it's made up of 11 members, 2 representing the Money Committee chairs, that's the Senate Finance and Appropriations Committee and House Appropriations Committee, or their designees. So the 2 representing on the board are actually the designees of those chairs. So presently this is Senator Pillion and Delegate Ballard, serving in place of, again, of Senate Finance co-chairs Hal and Barker, and then House Appropriations Chair Barry Knight, and HHR Secretary John Littell serves in an ex officio capacity. And then there are 8 gubernatorial appointees, including local officials and various subject matter experts in substance use treatment and recovery services. So looking at who can receive distributions from the OAA. So again, the only organizations that can receive either direct settlement share distributions or funding from the OAA itself are the parties to the legal action, which are the participating subdivisions that have signed the settlement MOU, as well as state agencies. However, localities in the state can partner with various organizations to provide services, but are required to adhere to procurement laws, must oversee the work performed by those organizations. So I already touched on this, but again, these are the settlements that are currently being paid to Virginia, and looking at a little more closely at what is included in those. So again, of these settlements that are being paid, the distributor settlement will pay a maximum of $21 billion nationwide over an 18-year period. And this requires a minimum percentage of those funds to be used for opioid abatement and remediation purposes. And it depends on whether a locality was or was not engaged independently in litigation prior to joining the MDL. At either 100% or 85% must be used for abatement purposes. Janssen will pay a maximum of $5 billion nationwide over 10 years and requires a minimum of 86.5% be spent on abatement purposes for all localities, irrespective of whether or not they were engaged in prior litigation. And pursuant to the agreement and the consent order, any use of funds for non-remediation purposes must be reported by the locality to the court and to the defendant. All right, so this chart provides an overview of the distribution of funds per the settlement agreement and the MOU. So in total, this represents about $536 million over the entire term of those settlement agreements coming to Virginia. So you can see that cities and counties direct shares are 30%, Commonwealth shares 15%, and the OA share is 55%, which is further subdivided between the localities and state agencies. And that 15% is reserved for cities and counties, and that blue square, that's we view those pretty much as entitlement funds. They have to be applied for to access, but essentially it's just as long as it's communicated that they're for an approved abatement purpose, consistent with what's called Exhibit E of the settlement agreements, and then with the OAA's restrictions on use, essentially, which are actually slightly stricter than the settlement agreements, then you would be eligible to receive those funds. So the bucket, the 15%, so the 30% share that you all have already received the first and potentially second payments from the settlement administrator directly. Those don't come through the Opioid Abatement Authority. Those are based on a formula that was established by an objective third party, actually affiliated with UVA, I believe, that are a percentage that is a per capita measure of harm in your communities. So the blue bucket from the OAA, the amounts that come from the OAA are actually based on that same kind of formulaic distribution method. So that's how those are going to go out. The other buckets, you can see the 35% for multiple for projects involving multiple cities and counties. That is for regional collaborative type projects. And by definition, that's 2 or more participating subdivisions can collaborate on a project to attempt to receive funds from those amounts. And then the state agencies, of course, are for the state agency projects that they will also attempt to obtain funds for. And then there's an unrestricted bucket where the board has pretty broad latitude, discretion, and how to use those funds, and those could be used for separate projects, for a local or regional project, or to augment any existing previously approved project. And again, they have a lot more discretion over how those funds are used. So again, two settlements thus far, about $536 million over the course of 18 years is the longest term associated with the distributor settlement. Of course, there are several other settlements in the pipeline right now, including drug manufacturers, Purdue, Mallinckrodt, Endo, Teva, to name some of them. And you may have recently heard the roughly $13 billion settlement associated with the retail pharmacy chains, Walgreens, CVS, and Walmart. And I think Walmart is the one that's closest to finalizing that. But it could be that Virginia's total allocation could increase somewhere between $800 million to $1 billion over the term specified in those settlement agreements. And so this graph depicts the estimated payout over the full 18-year period for both the distributor and Janssen payments from the Opioid Abatement Authority. So you can see that large spike in FY23. That is related to the Janssen payment. So Janssen is paying 4 years worth of payments up front, or about $39.8 million in the current fiscal year. So then they would resume payments in FY27. And they're doing that in large part because so many localities signed on to the MDL, right? So when these settlement agreements, and all of them are going to be somewhat unique in the terms, what has to be used for abatement purposes, how long it's going to be paid out, how much can be front loaded. And a lot of that is based on the degree of participation among the localities in joining the MDL, because that obviously reduces the liability, the financial liability on the side of the defendant, right? If all those individual suits kind of are lessened or go away. So again, this amount is going to fluctuate over time as more settlements come online, and the degree to which they're front loaded and how they're spread, and the term of those payments. So this, if it isn't already kind of confusing, it gets even more confusing as you start talking about the degrees of abatement purposes per the settlement, and the different kind of nuanced requirements associated with each one, and then how that differs from the requirements associated with the OAA's distribution of funds to localities. So again, those are all going to be a little bit different. Speaking to the two settlements that have been finalized thus far. So the pharmaceutical distributors and Janssen, all the funds are intended. So the language intends for them to be used for abatement purposes. And again, certain percentages are required. And I spoke to that a moment ago. And again, it's not different not only different between the agreements, but also different if you are litigating or non-litigating a locality prior to joining the MDL. So while the settlement agreement does provide for some percentage of funding for technically non-abatement purposes, it uses language that it says disfavors that use, and then again requires that any funds used for any purpose other than abatement must be reported to the settlement administrator, to the settling companies directly, and to the general public. So clearly they've put a mechanism in the settlement agreement that is strongly discouraging use for things other than abatement purposes, right? Because if a locality has to report to the settlement administrator, you got to report to the company, and you got to report to the general public that you use these abatement funds to do something like fill potholes, for example, or whatever it may be that wouldn't otherwise qualify. Not only is that kind of a bad look for the locality, but from a practical perspective, it gives an opportunity for a defendant to go to the court and petition the court to say, these localities aren't adhering to the terms of the settlement agreement. So we're asking that that you reduce what's required of us to be paid in future years. So if there was one or more localities that failed to adhere to this, and it reached a threshold such that a court would acknowledge potentially that a defendant had a legitimate claim that the Virginia wasn't complying with the settlement agreement, that would impact everyone, right? Because we're all bound together in this MDL. So that it's important. That's why I'm kind of stressing the importance of kind of adhering to the terms of the agreements and the OAA structure. So and given that, I think it goes without saying that given both the court-ordered and statutory restrictions on fund use, that localities should keep detailed records of how each dollar of settlement money is spent. So I'm going to go through, again, just some FAQs related to the direct distributions from the distributor and Janssen settlements. And then Jennifer, I think we'll probably pause and take some questions if that works for you. So looking at this, okay, so again, there are a lot of differences, and again, differences between those the amounts going directly to localities in the state versus the OA fund. So can a portion, and this is again just the direct shares going to you from the settlement administrator, can a portion of the funds be spent on non-abatement activities? So again, in some limited cases, although it uses language saying it's disfavored and requires notification, the settlement companies and the general public, it can be potentially used in some limited cases. So can the funds be used to reimburse a county to reimburse itself for prior expenses? Sometimes federal grants, for example, allow that practice, right? That's not clearly defined, but it could be possible, could be construed to be eligible in some cases, again, because it's not clearly defined in the settlement agreement. It does kind of create an avenue for it to be contested potentially, right? It kind of depends, and it's not real clear. So can funds replace local expenditures, otherwise known as supplanting, right? So that's, again, not clearly defined, same answers as the previous one. It may be eligible, but presents a risk. And then how is the agreement monitored? So it's the direct shares are monitored judicially, and record keeping requirements vary by settlement agreement. So it's going to be administratively challenging to not have a uniform method for not only accounting for the funds, if you're trying to stick to the letter of each settlement agreement, given that variability. So it's challenging if you don't apply a uniform kind of use standard to all of the settlement funds collectively. And so given that, Jennifer, if you'd like, I don't know if we have any questions at this point, given that it's all just kind of background information.
Right, we just have one question. It was asking if a copy of your PowerPoint will be available.
Yes, yeah, no, absolutely. And actually, I think it's going to be a link to we can make the copy of the PowerPoint available on the website, but a link to this is being recorded, right? So a link to the presentation slide deck and me speaking over it, if you care to revisit that again. I don't know why anyone would, but that's going to be on our website. That's going to be posted to the website. So yes, is the answer.
Okay. Another question came in. Are these funds available to towns?
No, actually, that they only can go to cities and counties, and that's not a rule we made. That is because those are actually at the highest level. Those are considered the legal subdivisions of the state with respect to this, and cities and counties were the only legal local parties to the lawsuit. Towns weren't, so towns would be included. And that's not to say the towns wouldn't be subrecipients of funds by the county, but it's a county, only cities and counties can actually directly receive funds. But again, they can partner with other non-governmental organizations, private entities, all different types of service providers, and a town could be effectively a subrecipient of those funds from the county's share.
Okay. One more question. Regarding the fiscal year 2022 funds that were received prior to this guidance, should we go back, restrict those funds and allocate to abatement expenses?
That is a really good question, and the answer is yes, I believe so. And that's not just coming from me, but that's coming from the Auditor of Public Accounts, and I was going to speak to that when we conclude. So there was a determination. So the APA, and this is kind of a long-winded answer, and I apologize, but the APA our Auditor of Public Accounts met with other states' auditors of public accounts and GASB officials, and made a determination based on when the settlement agreements were executed that those were referred to as exchange transactions, kind of like the master settlement agreement payments from back in the early 2000s, late 90s, early 2000s. Anyway, the practical implication of that is they need to be recorded and accounted for, accrued back to FY22 from an accounting perspective. So I know it's not CAFR anymore. ACFR that's the term now to describe your financial documents, your annual reporting documents. Those will need to be recorded in FY22, and I know they may require revisions to those documents. I'm not sure at this point, given that it's December, but so anyway, yes, and also when I speak to shortly an incentive that the OAA is going to be offering localities, consistent with a letter that all of your chief administrative officers, county managers, administrators, and so forth would have received, communicating this incentive offer that we'd like to provide to encourage localities to adhere to the OAA's standard of use. That would require what you've described essentially, right? Segregating those dollars, using them only for abatement purposes, recording them in a manner so it can at least be tracked so as not to inadvertently make yourself ineligible to access those funds, at least for the first year, right? If you intended to do so, right? Because it's kind of, in our mind, we feel like it's a pretty good deal, right? So anyway, I believe the short answer is yes.
Okay. A few more questions. One of them, and this might be better answered after the end of the presentation, can you list some examples of abatement efforts?
Yeah, absolutely. So again, the documents are out there. There are a lot of documents on our website that you can reference, and I'll bring those up again. They're posted to voa.virginia.gov. I'll run through that again at the end, but for now, just going off, it's essentially treatment prevention services and other efforts to otherwise abate or remediate the opioid epidemic, right? And there's quite a bit of latitude, but if you look at the code section that I referenced earlier that establishes the authority, you can see the abatement, the approved, it's called 2.2-2370, conditions and restrictions on financial assistance. And that essentially mirrors very closely what's in Exhibit E of the settlement agreements on restrictions on use, as well as what's outlined in the settlement allocation MOU between the state and the cities and counties. So one could be treatment of opioid use disorder and any co-occurring substance use disorder or mental health conditions using evidence-based or evidence-informed methods, programs, or strategies. So you're going to see that littered throughout the language, at least on the OAA side, evidence-based and evidence-informed methods. So we're not really looking to recreate the wheel. It's kind of like methods that have worked, programs that are certified, accredited by national or state associations and state entities such as DBHDS, approved certified treatment programs, Virginia Society for Addiction Medicine, and so forth, right? But in terms of what's defined, some examples, right? So supporting people in recovery from opioid use disorder, providing connections to care for people who have or at risk of developing opioid use disorder. So that's pretty broad, right? Supporting efforts, including law enforcement programs. But I will say that's not buying like SWAT vehicles or anything, right? That's like evidence-informed methods for treatment services that might be deployed in a correctional environment. It's not going to be like law enforcement type, vehicles and things of that nature. Efforts to address the needs of pregnant or parenting women. Again, these are all things that really closely mirror what was in the settlement agreement. Efforts to prevent overprescribing, prevent the misuse of opioids, reduce overdose deaths, and so on and so forth. So there's a list of, I don't know, maybe 15 or so. And that's not an all-inclusive or exhaustive list of what would be approved, but you're kind of getting the idea of where we are with, what is an approved use.
Gotcha. Two more questions have come in. Will we be able to return unused funds from the authority, similar to the CARES funding?
Oh, that's interesting. So I'll say I haven't really, I don't know if we've contemplated returning funds necessarily. I think and I'll talk a little bit more about this. We're in the process kind of determining the grant application process and the performance period for these, what we're calling grants, when they're just kind of our distributions of discretionary funds. That's especially with respect to the 15% formula driven funds. Those are kind of year funds. They're not really ours to take back. I mean, I'm sure we would accept it and reallocate them if you felt so inclined to do so, but I don't know if we've really envisioned a method to do that yet. So that's an interesting question. I'm glad this is being recorded. So we're going to go back and kind of allow us to kind of contemplate some of these things we hadn't otherwise contemplate. At least I hadn't. So maybe other folks in our staff have an idea of that.
Okay. All these questions are getting people's minds going because more questions are flowing in.
Yeah, sure.
Is there a timeline for spending the funding?
Yeah, that's a good question. We haven't. I believe there is going to be a timeline, but you know, and it may be treated on kind of a case-by-case basis. But there will be kind of a performance period where there's an expectation that something be implemented in a period of time, and I think probably more so with the discretionary dollars than the what we're calling again the entitlement share, that 15%. Having said that, you know, we're still figuring it out. I know January 19th, and I was going to talk about this at the end of the presentation. I know Jennifer mentioned it at the outset of the presentation. January 19th is when the application process is going to formally open, and that's also going to run simultaneously when we hold this grants workshop, and we're going to provide all of this sort of information. But we are we are a very new agency. We just moved into a building, and so we're moving as quickly and as prudently as we can to figure out all of that stuff. But we'll have answers to questions like that by January 19th, and then we'll give you all that sort of information at that time.
All right, here's another one. Would law enforcement officer awareness prevention efforts be applicable?
That sounds applicable to me. I mean, again, the devil's in the details. It would have to be, there's going to have to be a narrative justification for everything. But yeah, to me, that sounds like it would apply.
Okay, and this is the last question so far. In terms of mental health conditions, would school health counselors K through 12 be permitted?
I think you might have to clarify, be permitted to receive dollars. So that, yeah, a school, but if I understood the question correctly, if a school board can't be a direct recipient, actually they're considered a separate subdivision of the state. But it would be the locality the school division could work with the locality on creating a program to do that, but it would be submitted, it would be, the application would specify that, right? And then the funding would go to the locality, and then it would go to the local school division to implement whatever program. They couldn't be a direct recipient.
Okay. One last question just popped up. Are reporting requirements available now, or will we need to wait till January?
No, I believe reporting requirements to the OAA, I don't think those have yet really been established. I think the general thought is, again, then just segregate them and use them for what you, in your best judgment, is kind of, again, for approved abatement purposes. And you're not going to go wrong if you use them, your local direct shares, and you are recording those expenditures and adhering to APA guidelines with respect to the use of those expenditures. And so I think that's an important point. I think 99.9% of the time you're going to be compliant with whatever it is prospectively that we're going to require of localities to adhere to any standards with respect to, you know, if they want to apply the gold standard to their individual direct shares, that you know, the OA's methods being the gold standard, we're calling it. Yeah, if you stick to that, then you're going to be okay. So, and again, the APA has issued guidance on how to treat the funds from an accounting perspective, but also kind of opine on what they believe the funds should be used for and segregated for from a budgetary and accounting standpoint. So again, those documents are already available on our website. The APA just released that guidance because, again, of that, what I'd mentioned, that kind of FY22 accounting implication. They had to get that guidance out very quickly. And so you may get some information from that, right? And again, that's not coming from us, that's coming from the Auditor of Public Accounts as well. So yeah, that's the answer.
All right, so that's all the questions we have in at this time.
Perfect. All right, well, I will go ahead and continue then. So I know I'm kind of beating a dead horse now that I've talked about the difference between the OA's funds and the distributor funds. But so again, the OA's funds are going to have a much clearer set of rules. So again, 100% must be spent on abatement efforts, more specifically efforts to treat, prevent, or reduce opioid use disorder, the misuse of opioids, or otherwise abate and remediate the opioid epidemic. And all of those previous, all the types of uses that I talked about earlier would qualify. And again, there's quite a bit of latitude about how these funds are going to be spent. And again, those are enumerated in 2.2-2370 of state code. So where it's unclear or disfavored in a settlement agreement for OAA funds, there is no reimbursement of previous costs or supplanting allowed, nor are there indirect charges allowed. So you couldn't allocate a portion of your salary, for example, if you're a local employee, to the work you're doing for an abatement effort. However, if you were to hire someone to do abatement, 100% abatement work, I believe that's a direct cost, right? That's not going to be really an indirect allocation. So you kind of have to get into the specifics of how you account for what is and isn't allowed. In addition, recipients would need to report outcomes to the OAA on an annual basis and allow it to monitor the programs. And that's really just adhering to our statutory mandate that we make sure that the funds are being spent in a manner consistent with what they're supposed to be used for, right? But we don't have the staff or the inclination to really kind of engage in a sweeping audit program or anything like that, right? All we're trying to do from a monitoring standpoint, that is just make sure that the funds, again, are being spent consistent with how they're supposed to be spent. That's really it. So let's see. So given that, again, that the OA's use of funds are guided not only by Exhibit E of the settlement agreement and similar in state statute, and are clear on these use restrictions rather than what is implied or suggested in the settlement agreements, we're referring to, again, our OA's rules as kind of the gold standard for managing opioid funds. So if a city or county chooses to apply the OAA gold standard to all of their distributions, they will always be in compliance with the settlements. Even when there are differences between settlements, because we're always going to meet or exceed what those settlements require. And then we talked about kind of the administrative complexity associated with trying to account for each of those settlement funds separately. If you were to use a uniform standard, it would make it obviously less administratively complex. And then given that we're all bound together by the MDL, again, and I kind of talked about the fiscal implications from the defendants petitioning the court, of not adhering to the agreement specifications or the OA's terms, it could impact the entire Commonwealth, right? Because so it's mutually advantageous, mutually beneficial that everyone, all localities in the state itself, use the funds in an appropriate manner. And then if there were also a uniform usage that was consistent with the OAA, we would be in a position to be able to partner with and support a locality if there was any sort of judicial or legal question associated with their use of funds. So again, I mentioned in October, all of your head administrators, managers, your head executives of each of your respective localities should have all received an email and a physically mailed letter from our executive director providing information about your settlement payments, as well as an offer to incentivize voluntary participation to apply this gold standard I'm speaking about to your direct share distributions, as well as those distributed by the OAA. So that's kind of illustrated in this graph. So if you agree to treat these funds in this with the OAA the same way you treat these funds, for example, then the OAA would increase your share of that 15% bucket by 25%. So that's really the kind of the carrot approach to try and make sure that everyone does this for everyone's mutual benefit. That's kind of I thought a good way to kind of encourage that sort of what should already really be done based on what I believe you'll receive in terms of APA guidance, as well as what the settlement agreements are trying to communicate. So again, and there was a question on this earlier regarding what you should do now in terms of maybe reporting or segregating dollars or making sure that you're compliant with settlement agreements and maybe for future eligibility for the OAA's incentive. So the letter specified those steps to take advantage of the offer. And if you take these steps, I think you're also going to be compliant with whatever would be required of you in a settlement agreement too, right? So essentially making funds and expenditures are accounted for in a manner that could be later reported, that they're in line with the National Settlement Agreement, and then no supplanting or indirect costs have occurred. That's more specific to the OAA, is where you not supplant indirect costs. Again, that vague language in the settlement agreement may allow for that. It's not real clear, but the OAA certainly doesn't allow for that, and that's very clear in code. So, and then, you know, it would be preferable, it's not required, but it would be nice if there were performance measures implemented and maintained associated with that, so we can actually see a couple of years down the road when we've gotten data associated with these programs, what has worked and what hasn't, right? Because that may inform what a locality may want to do in the future, what the state might want to do, and you know, how we should do this from a collective Commonwealth sort of response to the opioid epidemic. So a few more details about OA funding. I think I've covered most of this, but again, this is speaking to that 55% share, Virginia's allocation, the amount of the money that goes out to the localities in the state. So the 15% reserved, I don't think I need to cover this again. That's again, driven by that formula, that objective, like per capita measure of harm formula. That's based on the amount of prescription opioids that were prescribed in your communities, the number of opioid related overdoses and ER visits, I believe, and then the number of opioid related overdose deaths. And so that was used, those three factors were used to compute per capita measure of harm in those communities. And that's the formula essentially that determines how much money you get associated with not only the 30% direct share, but the 15% that comes from the OAA. And then I don't think I need to cover any other bullets here. I think I spoke to all these things. So now in terms of prioritizing awards, and this is more for not your 15% allocation. This is more for the regional, the 35% for regional projects, as well as the unrestricted bucket that could be used to augment those regional type projects. So this is consistent with statute. Discretionary funding awards, for those discretionary funding awards, higher priority would be given to programs or organizations with established records of success. Again, evidence-based and evidence-informed methods, right? So I named a couple of different types of programs. I will say that this is going to be, at least, and it's going to be kind of a living, breathing document, but we're going to develop a toolkit, the first of which it will be made available on January 19th, that will allow localities. It's going to be reflective of a lot of programs that may help a locality make a determination, identify specific types of categories and programs, services they may want to use based on this toolkit of service providers in the areas of opioid use treatment, prevention, and reduction. Right, but that's going to continue to be revised. Go into number 2, programs and communities, and this is all by statute. Programs and communities with a high incidence of opioid use disorder or opioid death rate relative to population. Programs in historically economically disadvantaged communities, and those localities that can include a monetary match from or on behalf of the applicant, with a higher priority given to an effort with a larger matching amount to really get some economies of scale in there by having the larger matching amount. And fortunately, you can use, isn't always the case with federal grants, state grants, and so forth. You can use your share of opioid funding that you receive to match amounts that come from the OAA. So you can use those and kind of maximize that to get more funding from the OAA as part of your total application package. Now, speaking to coordination among the various stakeholders in order to best maximize the use and effectiveness of these settlement funds, there's really an opportunity to engage in a coordinated effort, including the OAA, localities, state agencies, and other service providers and stakeholders, based on a statewide mission with local stakeholders driving implementation. So in addition, the funds will also be coordinated with other sources of funding, other federal or state sources of funding for similar opioid abatement remediation purposes to avoid duplication of those efforts. So I'm wrapping up here. And just looking at the timeline for the OAA. So again, we've been busy the last several months just building out our small staff. There's just a few of us here. I don't know, we have 4, we're hiring a couple more, and that's really going to be where we kind of max out probably, right? It's just going to be a small number of staff, but we're setting up the office, our administrative infrastructure to get us in a position to begin to distribute these dollars to localities and state entities. So we've formed a grants committee that is going to review all the local and state applications that aren't otherwise delegated to staff to approve, and then they would recommend those for broader board approval. We're also holding a number of listening sessions throughout the Commonwealth. So it's like giving an opportunity for stakeholders to express how to best address the opioid epidemic in their communities, right? So the first of those was held in Roanoke on December 1st. That was followed by one in Fairfax that Saturday on the 3rd. The next one will be January 30th in Hanover County. And then there's an all virtual, and then there's going to be 3 more, Hampton, Charlottesville, and then Wise. So we're really kind of spanning the geographical regions of the Commonwealth to get some input from lived experience folks, people that are service providers in those communities to kind of so we can identify where the service gaps are, and kind of inform what we may need to fund, not only in total for the Commonwealth, but on a geographical type basis. So we are, again, I spoke to this on January 19th and 20th. We're planning to release the grant and distributions guidance to cities and counties and open the application process on that date. So that coincides with VML's Local Government Day, where Tony McDowell is our executive director. He's going to give the keynote presentation at the event. And in the afternoon from 1 to 4:30 p.m., the OEA is going to host a grants workshop for all cities and counties. And this is going to take place at the Omni Hotel here in Richmond. And then there's going to be a best practices kind of workshop the following morning. And I know Jennifer spoke to this, I'm just repeating it, but and the best practices is going to be more like what we were talking about in terms of types of service providers, categorical types of treatment, prevention, education, opioid use reduction type programs you might want to consider when forming your application. And we hope to turn around. So the application period is going to be open through May 5th of next year. And that's when the first round is going to close for these first allocations. And then we hope to turn around again the first round of awards by March 1st, and they would be awarded again on a rolling basis as received, with sufficient time to evaluate and get them out, probably by the end of the fiscal year, I would think, but the application period does close on May 5th. And again, I'd like to highlight just a couple of additional resources or sources of information rather that you may want to review. So again, the Office of the Attorney General has provided a summary of key provisions on the use of settlement funds, which is super helpful. And it goes into more detail than what I described about what's applicable from the settlement agreement perspective. Again, the OA standards are a little bit more strict because they don't have that weird wiggle room, that vague wiggle room about what you can and can't do with the funds. And they describe that in pretty good, understandable detail. And then the APA has developed documents to assist localities in financial reporting compliance and to properly accounting for your local direct settlement shares. And those documents are available on our website at oaa.virginia.gov. And you can click on the media tab and scroll down and you'll find those documents. And I think they're so recent, they're actually on our homepage. So when you just go to oaa.virginia.gov, I think they're going to be right there on the first page. Super useful tool. Like one of the APA documents is a Excel tool where you can click in, search for your locality, and it's immediately going to populate how much your direct share allocation should have been. And then it has instructions on how you should account for those funds from a GASB reporting compliance standpoint. So that's super valuable, I think. And they're also going to talk about, they have a more qualitative Word document that kind of talks about approved uses. and they mention the OAA, they mention kind of the gold standard, they mention what is and isn't applicable, right? So very helpful information. I really would encourage you to go check those out, and you can get them on our website. So that that concludes my presentation. There's our contact information. We're here to help you to the best of our ability. So don't hesitate to reach out. You know, don't all blow up my phone right after this thing or anything. I'm not suggesting that, but certainly feel free to reach out. We're here to assist, right? And happy to help. So yeah, that's it. And I'm also happy to answer any questions you may have this time.
Okay. We've got a few coming into chat. And then if you do have a question and want to ask it directly to Adam, go down to the reactions button at the bottom of the Zoom and click on raise hand. That way I can call on you and you can put it in your own words. All right, so one of the questions we had, sorry, my screen is moving because more are coming in. What is the timeline for accepting gold standard incentive offer?
Oh, that's a good question. So I talked about how you probably want to put yourself in a good posture to be eligible to receive those funds. I believe that is going to happen during the grants application process, right? Because that's when the entitlement funds are going to go out. So there's going to be an application to demonstrate how you're going to spend the entitlement share, that 15%. And then I believe there is going to be the process is going to be, we'll have a template board paper that you would be able to take and then get board approval to adopt not only to approve the program that you're submitting on your application, but also adhering to the standards, I think, associated with the OA's use restrictions, if that makes sense. I believe that's the process that's going to happen right now, but we have a director of operations who's going to have a better idea of the mechanics of how that's going to happen. But I believe that's all should be eligible technically on January 19th. I don't imagine we're going to get a lot of applications on the day, but beginning January 19th and through May 5th.
Okay. Will this be an annual application process?
Yes, it is going to be an annual process. And given where we are, the process, the time is probably going to change. The time of the year is probably going to change. So we're still working that out, but it's probably, it's not going to be, in January. It's going to be a different time probably. We're still working that out, but yes, it's going to be on a annual basis.
Okay. This one, we think you've answered most of it, but I just want to be sure. Is the locality payments lookup tool that was sent out by the APA just taking into account the direct share portion of the funding?
Absolutely. Yeah, that's all it is. That's a good question. Yeah, I think they might have a note in there that says something about that, but yeah, that's just your direct shares. That's not assuming any of the OA money that you would otherwise receive.
Okay. Is there a way to register for the distribution and grants workshop? Can you participate or listen virtually?
I'm not sure if there's going to be a virtual option. I'll have to get back to you. In terms of registration, if you're registered for the VACO event, the VACO VML day, even though they view these as two separate events, it's my understanding that you're going to be fine. So you can just go to this grants workshop, and it's kind of at the conclusion of that maybe. I don't know how long the VACO VML lobby day is going on, or the local government day. However, in the event that people hadn't intended to attend the VACO VML event and would just like to attend the grants workshop, I believe we're going to open a registration portal on our website, and that is kind of in development. So having said that, I mean, if you just need to show up, I would just show up, right? But we would like to track and see who's going to show up to make sure we have the number of resources and everything that we need. But I think most people that would show up to this are probably going to the VACO thing, and so if you registered for that, I think you're going to be okay.
Okay. Are localities going to be able to give money to our community services board to spend on abatement programs?
Yes, they're considered subrecipients, right? So the money would go to the locality, and the locality can partner with the CSB, and I would encourage any locality to do so.
Okay. And this is going back to the K-12 question in regards to school mental health question. Several localities are losing third-party contractors who provided mental health services to at-risk students reimbursed by Medicaid. That was what the question was referring to.
So it's asking if those private contractors would be eligible, they could use the money for those services, I'm guessing?
I believe if the person asking the question would be interested in jumping in on this, that would be great. Okay, here we go. You want to go ahead and ask your question?
Yes. My name's Andre Villiers from Wise County. And like I had posing the question, several localities here in Southwest Virginia utilize family preservation services was one of them. And those were reimbursed by Medicaid. And that funding is going away actually next week. And those people are going to no longer be in the schools, and the school systems, they're not paid employees by the school systems of the counties, a third party, and they were reimbursed by Medicare. And I'm sure it's not necessarily opioid abatement treatment, but it was mental counseling for at-risk students. And the question has been brought up is, would the opioid funds be able to have some kind of replacement service?
Yeah, no, I got you. That, I think if there is a nexus, see the way that's, I don't think if there is a nexus to opioid use, because it says opioid use or co-occurring substance abuse or co-occurring mental illness. So the nexus there has to be a nexus to opioid use. But in terms of the structure with a pain, so essentially supplanting federal dollars that are expiring to employ those people, I feel like that would work. I feel like that's okay. But there would have to be a nexus to opioid use. So that the mental illness, the co-occurring, and a lot of times, I don't know what the percentage is, but high rates of co-occurring substance use and co-occurring mental illness with every case of opioid abuse, high percentages, right? So it potentially could be structured in such a way that there's a program that again has a nexus to opioid use that's providing mental health services, but again, there would have to be a nexus to opioid use to qualify.
We're actually in Southwest Virginia, and that was one of the higher, I guess, funded from these settlements based on per capita abuse.
Yeah.
And I'm sure a lot of that stems from that. But my question would be, though, is how would you monitor something like that if you did fund it and say, well, what percentage of your program or services is for opioid abatement and what is it for mental health? So I don't want to run into a problem just trying to do the subrecipient monitoring.
Yeah, exactly. I mean, that would be an issue. It would be a little bit more administratively challenging, I think, anytime you attempt to do that. And that's not to say if you're doing a program and you propose to pay folks administering a program, third-party folks administering a program that was, say, 60% opioid related, I mean, you would probably have to substantiate that somehow, and then you would also have to kind of monitor it too. So it would be incumbent on you to be able to kind of prove that, or at least, you know what I mean, demonstrate that you're overseeing it and validating that that's actually occurring, right? So I mean, I understand what you're trying to do and totally agree with your approach to wanting to find a creative way to continue to pay for those folks. But just speaking to what's required in the settlement agreements and statute, there would have to be some nexus to opioid use. And as you mentioned, it would be administratively a little bit more challenging for you all to manage.
Okay, thank you.
Absolutely.
We've got one last question. Oh, as soon as I say that, there's another question in the chat. All right, that's great. The grants application will be for 35% of the funds allocated towards regional programs, or for the unrestricted 35% discretionary funds, or both?
Definitely the 35% regional, and likely some of the 35% unrestricted. The unrestricted, again, say you had a project, a regional project with 4 localities that paid whatever, right? Say it was $500,000. The board could say, and you could present another application at some point. I don't know if it would be concurrently, but maybe the following year, saying this program is achieving success. We would like to grow the program and tap not only maybe your existing 35%, your share of the 35% in the subsequent year, but maybe the board would say, you know what, that is a really good program. We're going to give you however many X dollars from the discretionary, from our unrestricted bucket, to augment that program that we approved out of your regional projects bucket, if that makes sense.
Yeah. All right. When do you anticipate the OAA will begin approving regional applications?
I mean, they're eligible to be submitted, I believe, on the same day as the entitlement fund. So, I mean, if you having said that, I mean, it takes a while to put together those regional projects, right? So, the application process opens January 19th. I believe it's applicable to the regional, so all of the discretionary funds. And it's open through May 5th of 2023 for the first round.
Okay. Are there limitations for when proposed programs must be completed by? In other words, will localities be able to submit multi-year strategic funding program proposals? Additionally, will the awards include program extensions if necessary?
Yeah, I mean, we've talked about that, and I believe so. I think we're still kind of figuring out the mechanics of that and how we accomplish that. But I think the idea is if you say, not only, we got to look at if it's an upfront, if you're trying to get like 5 years up front, or it's like you put in a project saying we want to dedicate 5 years of our annual, what otherwise would be our annual payment without reapplying each year, then yeah, absolutely, that's going to be done. I think we're contemplating both opportunities at this time. So the question is yes, the answer is yes, rather, we're just figuring out kind of how that's all going to work mechanically.
Thank you, Adam, for taking us through this all.
Absolutely. Thank you, Jennifer, and thanks to everyone on this call. I really appreciate it.